Good morning, all. I'm Dr. Gayathri NS, working as Assistant Professor of Chemistry in SNS College of Engineering. Today, I'm going to share about the case study, which is about the Bhopal gas tragedy. It has happened at December 1984. In the year 1984, which is a massive toxic leak from Union Carbide India Limited, which is commonly called UCIL. It is a chemical plant at Bhopal, in which thousands of people were killed and hundreds of people were injured by the 40-ton release of methyl isocyanate, caused by unsafe condition and series of failures in poorly maintained and understaffed plant. It is a sad statistics. It has happened in the night of 2nd and 3rd December 1984, when a pesticide plant of Union Carbide India Limited spewed at about 40 to 45 tons of highly lethal MIC, that is methyl isocyanate gas, in Bhopal. It is in Madhya Pradesh, India. It is one of the worst industrial disasters in human history. Among people who were exposed to the gas, 20,000 people died and 55,800 and 125 were injured. 1,20,000 continue to suffer devastating health effects. It is also called as Bhopal gas tragedy. Was a gas leak incident in India, considered the world worst industrial disaster. Already said, it is in the occurred at night of 2 and 3rd December 1984 at the Union Carbide India Limited, which is a pesticide plant. Over 50,000 people were exposed to methyl isocyanate. These are the pictures at Bhopal case study. Bhopal tragedy happens at the site. The thousands of people had died by the following morning. The primary causes of death were choking, refluxogenic circulatory collapse, and pulmonary edema. The findings during autopsies revealed changes not only in the lungs but also cerebral edema, tubular necrosis of the kidney, fatty generation of the liver, and necrotizing enteritis. The stillbirth rate increased by up to 300% and neonatal mortality rate by around 200%. The aftermath of the leakage. The medical staff were unprepared for the thousands of casualties. Doctors and hospitals were not informed for proper treatment methods for MIC gas inhalation. They were told to simply give cough medicine and eye drops to their patients. The gases immediately caused visible damage to the trees. Within a few days, all the leaves fell off. Operation Faith on 16th December, the tanks of 611 and 619 were emptied by the remaining MIC. This led to a second mass evacuation from the Bhopal. The effects of human health. Respiratory disorders, irritation to the lungs causing coughing, shortness of breathing, higher exposure caused buildup of fluids, caused asthma. Cancer hazard, caused mutation, genetic changes in the human body. It caused cancers. Reproductive hazard, association between exposure to methyl isocyanate and miscarriages had happened. It may damage the growing fetus. May also affect the fertility in men and women in that area. The traces of many toxins were found in the breast milk of mothers and were in turn transmitted to the recipient babies. healthcare. In the immediate aftermath of the disaster, the healthcare system became tremendous overloaded. Within the weeks, the state government established a number of hospitals, clinics, and mobile units in the gas affected area. Radical Health Group set up JSK, the People's Health Center, that was working a few years from 1985. The government of India has focused primarily on increasing the hospital based services for gas victims. Several hospitals have been built after the disaster. In 1994, there were approximately 1.25 beds per thousand compared to the recommendation from the World Bank of 1 beds per thousand in developing countries.